Hey guys, it's me, Akashic Love and BPD Awareness, and I hope you guys are doing wonderful. I have not been able to make videos, excuse me, videos recently between gluten and my BPD. It can get pretty rough, but it's okay. So I'm making one now. I'm determined. So this video is going to be about treatment options. On my journey with BPD, I've discovered many treatment options. No, I haven't. I've discovered 3. And the 3 are, the first 2, they have something called dialectical behavioral therapy. And I really don't care for it. And then there's something called you have dialectical behavioral therapy, and you have medicated therapy. I suggest medicated therapy, especially for severe cases. If your life is in danger, or if someone else's life is in danger, you might the medicated isn't too bad. But the third one is kind of ironic how I found it. So as you guys know, I meditate, and a lot, and I talk about my dreams a lot. So I understand the subconscious world, the beta state, theta state. I think all that's pretty cool, right? So I was walking down the street, and there's this bookstore that gives books away, and I always stop and look. Sometimes I take some, sometimes I don't. And this time I saw a book called Hypnotherapy for the Beginner. And when I grabbed it, I just looked at it and I was like, well, that seems cool. I wasn't thinking too deeply about it. And then I decided to read it. And in the first few pages, I was so shocked because this program, or this scenario it's basically outlined. It's something that I hadn't thought of before, because I meditate because I know that you have to keep your mind calm, but I also know I'm battling my subconscious, and that's what hypnosis does. It's like a tool for your conscience, it's like a tool for your subconscious, and it's like really awesome, because most people with BPD, it stems from PTSD or trauma, right? Most people with BPD have PTSD and trauma issues. So I realized that that I understand that your brain is a machine, and I understand that it can be programmed, and I understand that it can be reprogrammed, but I wasn't really understanding exactly the process in which that takes. And that's what I kind of learned about that. So, of course, the medicine is like I've been doing the medicine, but the medicine helps, but it doesn't alleviate symptoms. Like you still have the symptoms. Um, More so, you're just trapped. You're like on the inside in pieces, and you're just in a vessel. I guess you're just in calmer pieces, I guess. But the hypnotherapy kind of gets to the root of whatever is hurting you or ailing you. The dialectical behavioral therapy, I don't personally care for it because it's like, I'll ask, like, why do people like to say Merry Christmas? Like, everyone on Christmas. Like, it's weird to me. But some people never question it. They just say it and they do it and go along with it. And it's not a question for them. But for me, it's a question simply because what if I don't celebrate Christmas? First, I can't really even introduce myself. So just to have to say something all day is torture. Or not really the saying something all day, the acknowledging different people and different energies and different emotions all day is what happens. That's it. And it's draining. It's so draining. I don't wish people could understand because it's draining, like, oh, you choose to be an introvert. You choose to be antisocial. You choose to... Maybe my mind is just clear. Maybe I'm clearly in a place where I'm happy. So that's how the disassociation happens. Because in your mind, you're somewhere completely else. But to you, you're clear. You're fine. And that's the point. I am fine. Nothing wrong with me. Because it's like, it's just like, it helps you understand that you are a universe within your own universe. You are exactly the way you're supposed to be. Even if people are like, oh, you're too this, or you're too that, or too that. It's just misguided energy. That's really all it is. Or like just social norms. I don't really get into. But personally, I like it. I find it awesome to be an individual. So I do it. So yeah, I stay an individual with my personality, and I'll mask if I'm at an interview or somewhere important, but I've gotten to the point where I just look, if you're my friend, I tell you, and if you accept it, wonderful. If you don't, wonderful. Because like, it's so much. That's so much energy trying to care if you're going to be accepted by everyone. The truth is even if there was, like, I guess, even if you didn't have that diagnosis, that individual would still probably find something devastating. You know what I mean? People will always find a reason to not like you or something. So that's yeah. So basically, it's what you feel like dealing with. I'm not saying that the dialectical behavioral therapy doesn't work. I know a lot of people that say it does, but it's not for me. It's just not. the medicine helps. But because I'm into dreams and meditation so much, I'm going to give the hypnosis thing, self-hypnosis thing a shot. I'm going to record my hypnosis sessions, and I guess I'll update as much as possible, and you guys can see how that works. So thank you for watching my video. I'm so grateful that you do. And I hope you learned something interesting, and I hope you have a wonderful night. Bye.